Right. So coordinated entry, what is it? How is it done? Why do we do it? So the way that coordinated entry is set up in the COC is that there's a set of access points. There are over 50 access points that in the community that use a standard assessment, the Vi Spadettes, to gather information about folks' housing needs and preferences and vulnerabilities and the barriers that they face to housing. And then the idea is that the folks who are deemed most vulnerable based on this Vi Spadettes assessment are prioritized for referral to available housing services. So the folks that fall into the top scores of the assessment are prioritized for permanent supportive housing. The folks that fall sort of in the middle range of the assessment are prioritized for rapid rehousing and transitional housing. And the folks who fall towards the bottom of the assessment scores are referred to other short-term services. Why coordinated entry? Why do we have to, at this point, prioritize for housing resources? Obviously, this is not the ideal situation, but right now there are not enough housing units or vouchers for all folks experiencing homelessness in the county. So coordinated entry aims to prioritize folks who are least likely to be able to resolve their homelessness on their own without assistance for those available resources. So the system also aims to provide information about needs that aren't met so that the county, the COC can advocate for more resources to fill those gaps. Some of the goals of coordinated entry are to minimize, to remove as many barriers as we can and streamline access to housing so that we can move folks as quickly as possible from homelessness into housing. Also to clearly communicate what's available and to provide an assessment that's standardized so that everyone's going through the same process to get into supportive housing. Again, another goal is to prioritize folks who are most in need of assistance and to match people to the types of programs that are the best fit for their situations. So what's the current approach to prioritizing services, supportive housing in Santa Clara County? As well, most of you probably know, it's the Vulnerability Index Service Prioritization Assistance Tool, the Vi Spadettes, first acronym ever, that determines who will be referred to supportive housing first. The Vi Spadettes is based on a long set of questions that require self-reported information about folks' current situation, their past experiences, to evaluate their vulnerability and barriers to housing. It includes questions, as many of you know, quite sensitive questions, like questions related asking someone if they've tried to harm themselves or anyone else in the last year. The Vi Spadettes asks if folks exchange sex for money, run drugs for someone, or have unprotected sex. It asks whether drinking or drug use will make it difficult for you to stay housed or afford housing. So it's a long list of sensitive questions. And people with higher Vi Spadettes scores are referred first. So that's the crash course on coordinated entry. So I'm going to pass it to Layla for a few minutes to talk about how coordinated entry is doing in Santa Clara County, to talk about the assessments that are happening and how many people are on the community queue and how many people are getting referred to housing through coordinated entry. And after that, we'll dive into why are we talking about redesigning it. So Layla. I will share your, okay, I'll share your slides and I am ready for you.
Great, thank you everyone. I'm Leila Qureshi with the Office of Supportive Housing at the County of Santa Clara. So I'll be going over some of our data from the Coordinated Assessment System for the county, dating back to November 1st of 2015. That's when it started, up until December 31st, 2021. So overall, we have over 46,000 total Vi Spadettes that have been completed, and this includes duplicate assessments. But if we deduplicate the assessments, we have 29,695 unduplicated assessments. And these are deduplicated by a person's first Vi Spadette assessment date. So if we break it down to the type of Vi Spadette assessment, there are over 23,000 adult Vi Spadettes that have been completed, around 1,900 youth, transition age youth Vi Spadettes completed, 4,620 family Vi Spadettes, and 63 justice discharge Vi Spadettes. And just to note that even though, so for the transition age youth Vi Spadettes, they comprise 6% of all assessments, but transition age youth individuals also complete the adult Vi Spadette and the family Vi Spadette. So they actually comprise about 13% of all Vi Spadette assessments that are completed. And these numbers include Vi Spadettes that were completed by victims of domestic violence, and the data unfortunately couldn't be updated up until December 31st, but the data is current up to 9/30. But roughly, I was looking at the numbers, and roughly there are about 40 Vi Spadettes completed per month that are in the confidential queue. All right, so here we see the breakdown of the Vi Spadettes based on their score. So if a person scores over 8 on the single adult Vi Spadette or a 9 or 9+ for family Vi Spadette, they are placed in the permanent supportive housing range of intervention. So 37% of individuals, of households, score in that range. If the household scores 4 to 7 for the single adult Vi Spadette and 4 to 8 for the family, they fall into the rapid rehousing range of intervention, and that's 48%, so nearly half. And then there are clients who fall into the minimal intervention range, which is 15% of clients, and those are for clients who score in the 0 to 3 score of all assessment types. And from these assessments, we have over 3,000 permanent supportive housing referrals, so referrals to PSH programs to date, and over 7,500 referrals to rapid rehousing programs to date. And just to note that the data for rapid rehousing includes what we call direct referrals, because sometimes there are enrollments in rapid rehousing programs that occur outside the coordinated assessment system. They're called direct referrals. So they don't necessarily have to have an assessment, but they are enrolled in certain rapid rehousing programs. And usually they are the veteran programs or some CalWorks, some family programs. Okay, so here we see a few slides, a few charts that show our some parts of our community plan to end homelessness. So one of our goals is to house 20,000 people by 2025. And we started this, our starting point is January 1st, 2020. So far we have housed 5,941 people. So it includes adults and children since January 1st, 2020. So basically over 2 years. So we are 30% to our goal. And to the right, so we see the number of households which were housed in calendar year 2021. So there are 1,937 households housed, roughly, around 3,000 people who were housed in 2021. And the chart below shows the breakdown of single adult. 67% were single adults, 24%? Yeah, 24% households with children, and there's households without children, 5%. And then single child is, there are clients who were younger than age 18 and usually in youth shelters who are staying, maybe they were staying on outside and they came to the shelter and then they were reunited. Usually the situation is they were reunited with their families on a permanent basis. And then the chart below shows housing placements and system entries or homeless inflow by month. So we measure homeless inflow. One of our measures of homeless inflow is the first time a client takes a Vi Spadettes assessment. So that's one way we measure homeless inflow into the system. So the chart shows by month how many households we house that month versus how many clients or how many households took the Vi Spadettes assessment for the first time. So we see that the house number is less than the inflow number, but the gap is slightly less than what it was like if you look at March 2021 versus now, the gap is slightly less. And just as an average, in the past 12 months, an average of 162 households per month were placed into permanent housing, and an average of 262 households per month have taken the Vi Spadettes assessment for the first time. And their score ranges are 14% were in the minimal range, 47% in the rapid rehousing range, and 39% in the permanent supportive housing range. Okay, and any questions?
Layla, it looks like there's a question in the chat that came in that asks if there's a breakdown of housing placements by age group.
You know, I was going to do that, but I didn't include it in these slides. I mean, I don't know if we want to get back to that later, if I could like quickly run it and show that number. But that's something I could easily provide, yes.
Maybe, Layla, we can include it in the posted materials.
That's a good idea. Okay. Yeah, usually I have a complete demographic breakdown of the housing placements, but I didn't know if there was gonna, I didn't have time to do that.
I have a question if it's okay to ask. Hello?
Yes.
Oh, okay. I didn't know if anyone heard me. Yeah, I'm Serge. I'm the Associate Director at PATH, People Assisting the Homeless. I oversee our street outreach team. I've noticed a trend when it comes to the coordinated entry system regarding the scores that participants are given. We know, my team has noticed over the years that people who tend to score anywhere from 4 to 7 are referred to rapid rehousing programs, and that people who are in the ranges from 13 to 16, or I don't know if 17 is the highest for an individual, are typically referred to permanent supportive housing. What we have noticed is that anyone from the score ranges of 8 to 12, they don't seem to be pulled for any type of housing opportunity, not that we know of. Do you have data and information about, the percentage of people based off scores, like where they're going to, what type of housing opportunities?
Yeah, I don't have that currently, but I can definitely pull that data, and that's that would be very, very insightful to pull. So thank you for bringing that up, and maybe I could pull that data and we can put it on the slides as well. So basically, by the score, how they're housing out, like from the range of 8 to 12 specifically.
Yeah, yeah. We typically find that there's really no housing opportunities or a low amount of housing opportunities within the coordinated entry system. We tend to try to house our folks outside of the coordinated entry system for those individuals who are scored within that range.
I think that's a supply problem. So the reason that we set up this banded system or this tier system of coordinated entry is that we have a limited supply of certain kinds of resources. And so because our process is to prioritize the most vulnerable and that with the highest needs first, that's why folks in the higher end of the permanent supportive housing range get referred and prioritized. And as you saw, we continue to have inflow. And so new people keep coming in who are in the high end of the range, which results in the unfortunate consequence of people in the lower end of the permanent supportive housing range not getting referred, but it's a supply issue. So while we also are here to talk about how we address that issue, I think that's one of the reasons that we want to revisit the coordinated entry system and how it's working. But it's all there. We will always, until we increase the supply, we have the potential to have this issue, which is why the coordinated entry system exists.
Thank you for that. I would have to say this, you know, I definitely understand the importance of the coordinated entry system and identifying people who are at the most vulnerable and trying to place them into housing quickly. I think some of the issues with the coordinated entry system is that because it's self-reported by the participant, sometimes you have participants who are poor historians, or you have participants who may not be comfortable with disclosing, you know, things in their life that may be a more accurate picture of what's going on. So sometimes there's a question about whether or not they're being scored accurately. And so you may have some 10 that might be in fact a 14 to 15. And so, you know, but they're kind of stuck in this kind of limbo where there's no housing opportunity, and you know, but they're still vulnerable. So, you know, I definitely appreciate your response. I'm just, you know, I guess the question is like, what's the solution?
Well, you're at the right meeting, Serge, because that's what we're talking about here. I mean, I think the points you bring up, this is KJ with the Office of Supportive Housing. The points you bring up are exactly why we're having this discussion today. And, you know, there's a number of reasons why we're looking at re-envisioning our coordinated entry system, but that's what we want to do. That's what we're here to discuss. We know it's not perfect. We know we need to do something different, but what does that look like? And, you know, when thinking about where we've come from, we started this current system 2015. Some of you were here and that are here today were helped in designing the system based on what we knew then, based on the tools available at the time. We're 5 years in now, over 5 years in now, and heard from the community the same things you're saying, the challenges that we have with the current system, including people lingering on the queue, never getting a referral, including challenges with self-report. We also have a much deeper focus on racial equity in our community, and know that while maybe the current system isn't making racial disparities in the homeless population worse, it also wasn't designed to address them. And we as a community and as a COC have a goal to reduce the racial disparities that we know are present in our unhoused population. So we've come a long way. As Layla showed, we've housed you all have housed thousands of people through this system. It has helped people, but there are challenges. And the primary reason we're doing this is because we've heard from people with lived expertise of homelessness. We've heard from our system partners that it's time to relook at how we do this. And it's going to be a long process. And I'm so grateful for all of you to be that are here today to kick this off and to start thinking through it for the very reasons that a lot of you have raised. So sorry, Sasha, I just kind of jumped in there unannounced.
No, that was perfect, KJ. Thank you. I think folks are underscoring, yes, a lot of reasons that we are here today and that we want to chat about what a redesign could look like. Just to touch on some of the other issues that we have heard in terms of the Vi Spadettes specifically, is the problems with the fact that it's super sensitive personal questions, and the folks that are in a crisis, you know, it's wild to be asking those questions to someone in a crisis. And it can take up to 45 minutes, which is a really, really long time for an assessment. It's also not clear if it's effective in actually identifying folks that are vulnerable in Santa Clara County. And the questions are intrusive and stigmatizing and can really affect the relationship between the agency and the client. It can really work against building that trust as someone accesses the system looking for help. So, and as you underscored, there's a lot of folks who are never scoring high enough to be referred to housing. And also that, you know, as Serge mentioned, folks might not be able to either recollect past experiences, especially traumatic experiences, or to be able to talk about them in response to the Vi Spadette, especially folks in already stigmatized groups. So I'm actually going to skip the what other challenges question right now so that we can focus on what do we want this process to look like, and so that we can give our presenters as much time as possible. But we do have a Jamboard that I want to share with you. So I'm going to pop a link into the chat for this Jamboard, and we like to talk a little bit about oops.
Hi.
There we
Hi,
go. Welcome,
everyone.
Rena.
Thank you, Sasha, and hello, everyone. It's nice to see you all on Zoom stamp size on my screen. I'm a professor here at Allegheny University of Technology, and I've been working mainly in Allegheny County for the last few years, helping them change from a Vi Spadette type tool to a predictive risk model. And with Allegheny County support, we are making those methodologies also accessible to other other coordinated entry groups who might be interested in pursuing something along these lines. So I'm just going to share my screen, and please do feel free to ask questions in the chat or right from the get-go. So this is a joint work. I'm hoping everyone can see my screen. This is joint work with Allegheny County. So I think people have already brought up the challenges that I see. I mean, I've shadowed folks across the system. The number one issue, unfortunately, nothing we do in the assessment field is going to address this. It's really a question of how many beds we have. The fundamental problem is we don't have enough PSH or TH beds for everyone who needs them and could in fact benefit from them. So people who could have better outcomes by being given these beds do not get those. But the way we currently do a lot of our coordinated entry systems is we nonetheless, anyone who wants to be even considered for the PSH beds has to sort of expose their whole life history to strangers. And we do that knowing that the majority, that 90% of them won't get a PSH bed. And then what we do is, even for folks who do meet certain thresholds that we've got in place, we put them on a wait list. We don't give them a bed. And once they're on a wait list, what I've been really surprised at is we don't offer them services. We don't manage their wait in any way. We don't have social workers reaching out to them to help them with the challenges that in fact got them onto the wait list. We often think we've done our job when we put them on a wait list. Unfortunately, that we don't give them any indication of how long they might wait, what the nature of that wait might be like. And the challenge for clients is that once you're on a wait list, it's actually sometimes worse than being refused, because it stops you from pursuing alternatives, and yet it gives you no certainty about what you might expect, and more importantly, when you might expect it. And so then we also don't know if we prioritize, if the people on the wait list, and in fact the people who go through to PSH or TH beds, are actually the ones who are of greatest needs. When a system like ours is overwhelmed with people with high needs, it's very hard for us, just using our own human judgment and a short conversation with a client, to know how to prioritize clients at all. It's not like a system where we're sort of meeting 85% of clients and we know 15% probably should be in another system. This is probably a system where we're serving, 10% of clients when 85% of clients should be given a service. So we're really being overwhelmed by need. So our ability to figure out who is the highest of the high needs is really challenged. So when we put people on wait lists and put them into PSH beds, we can't be sure that the day a person moves into PSH bed that person is the person in our whole system, across our wait list, across all the folks who are eligible, is the person who's most at need on that day. And then subsequently, because we have got such poor prioritization processes, we can't actually convince funders and lawmakers the size of our unmet need. We know we put 10% of people into a PSH bed and maybe another 20% of people into TH or rapid rehousing. So that leaves us with 70% of people we don't give services to. Now, we can't convince a lawmaker that every single 70% of those people have high needs, but we can't give them a sense of how big a gap between need and supply there is. So a HAST, or a housing assessment screening tool of the type that we work with Allegheny over the last few years to build, is something slightly different to the Vi Spadettes. It is still a triaging tool. It doesn't have the miraculous ability to provide more housing beds, unfortunately. It is simply a tool that is trying to prioritize clients to those existing small number of beds, but it's trying to do that in a different way, and we feel a more appropriate and ethical way. The HAST is a triaging tool that uses an approach called predictive risk modeling. Because it uses predictive risk modeling, it's actually built on data from the jurisdiction in which the tool is being used. So in Allegheny, we used data from Allegheny. For those who you don't know, Allegheny is the county associated with the city of Pittsburgh. We used data from that county to figure out the kinds of questions and the kinds of data fields that will most be predictive of future risk. And so from that, we have two types of HAST tools that are being used, or the housing assessment screening tool. One is a HAAS tool that is probably most appropriate for you here in Santa Clara. It's for use by COCs that have only HMIS data and a bank of questions from the Vi Spadettes, but don't have an integrated data warehouse. For some COCs, including Allegheny, some of their clients are actually registered in an integrated data warehouse. And for those kinds of counties, they can actually do the assessment without asking a single question by bringing forth all the historical data that they have about the client. So the Allegheny uses a HAAS data warehouse and a HAAS tool. The HAAS data warehouse tool works like this. Folks in Allegheny County call up to their homeless coordination system. If they're registered in the data warehouse, with the client, they are still asked about their chronic homelessness history, about any prioritized, whether they're veterans, whether they're subject to domestic violence or interpartner violence, and those sorts of things. But they're not asked any questions that are about their needs assessment. Instead, the tool takes their first name, last name, social security number, and goes and takes all the information that is already held about previous emergency room visits, mental health service usage, previous homelessness interactions, and so on, and generates a score instantaneously between 1 and 10. Now, the frontline workers who are doing the assessment take the score and then consider the conversation they're having with the client. And if they feel that this client is at much more higher, should be scoring much higher than the tool is suggesting, they're able to override the tool. But so far, we haven't seen a lot of overrides in the use of the tool. The second approach, which is, as I say, is more relevant for Santa Clara, is that a client comes in and they're not in Allegheny's data warehouse. They might have previous homelessness use, so you might know about their homelessness history using the HMIS, the homelessness management system, but don't have a lot of other information about the client. In that case, they still use a set of questions, but those questions are much shorter and less invasive than the Vi Spadettes, and they're designed to predict outcomes for that client. And here are the outcomes that Allegheny chose to base the score on. So the way that we developed the scoring system for Allegheny, a person who has a high score and is therefore prioritized has a higher risk of having an overnight stay in hospital for a mental health inpatient stay, or has a high probability of having a night stay in jail, or has a high chance of having 4 or more emergency room visits in the next 12 months. Because it's a predictive risk model, it really is a model trying to predict the outcomes for people whose scores it's developed for. So here is how good it is. So what we've done is we went and we took our model, the tool that we'd built, and we applied it to thousands of Allegheny homelessness clients, historical clients. So this was in the past. And because they were historical clients, we could follow those clients historically as a research exercise in 12 months of data. And so what we found is that clients that scored a 10 on the HAAS tool were considerably more likely to go to jail, to go to ER 4 more times, to have a mental health inpatient stay in the next 12 months, or in fact be chronically homeless in the next 12 months. Now, chronic homelessness here is not our traditional chronic homelessness. It's being seen for 3 months out of 12 in street outreach or a shelter, because we didn't have actually data on whether they were truly chronically homeless. Now, clients who scored a 1 were at much lower risk of having that happen to them. So when we applied this and showed it to Allegheny, they felt that this tool was quite valuable for them, in that they felt that when they gave a PSH bed to someone, they would like to feel that given that everyone is at high need, they were giving it bed to the person, the client who was at highest need of some of these adverse outcomes that are associated with homelessness. The other question Allegheny asked us to look at is, they said, oh, how does our current Vi Spadettes tool sit along this same spectrum? Is it also associated with highest risk? And on the right-hand side there, on the left-hand side, I'm still plotting the scores on versus the outcome that I just explained. And on the right-hand side, I'm plotting the Vi Spadettes score against prevalence of the same outcomes. So the green line is future chronic homelessness, and you can see there's almost a declining risk of chronic homelessness as Vi Spadettes scores get higher. There is a slight upward trajectory in 4 or more ER visits. There's certainly a slight upward trajectory in having been in hospital for mental health inpatient stay or a jail stay, but it's certainly not as highly predictive of those risk factors as the HAST tool. Allegheny was also, now I've got to be careful here, because when you read the literature and the evidence for Vi Spadettes, we would probably not expect this to be the case. For one thing, the Vi Spadettes wasn't built for the counties that it was being applied to. 2, it was never meant to predict these ranges of adversities. However, one of the things that Vi Spadettes was supposed to be predictive of is future death. We know mortality rates are very high for people in the homelessness system. And we would hope that people who had been prioritized for PSH because they scored high in the Vi Spadettes were those people who were the most vulnerable. Unfortunately, when we looked at the Allegheny data, those who scored and were prioritized in the Vi Spadettes, when we followed them, even if they were unhoused or if they were housed, they were at no more risk of being of dying in the next 12 months than those who were not scoring high in the Vi Spadettes. On the other hand, the HAS score identified and prioritized clients who are around 3 times as likely to die in the 12 months following an assessment than all other clients. Now I'm going to check the chat, because when I present, I can't see the chat. So if anyone's asking me a question, can you just shout out? Because honestly, if I've got slides on, I can't see chat. Anyone got any questions? I'll shut up for a minute.
And I think folks were mostly continuing the prior discussion. There was a question about the data included in the warehouse. I did send a link to the Allegheny County report that has an appendix with all the sources, but maybe you can go over that real quick.
Yeah, so the data warehouse model, you guys probably wouldn't have that data all integrated, but it's behavioral health services, it's physical health services, it's all Medicaid funded, it's previous homelessness services, and jail jail and court data are the main ones. All right.
I want to go back to just a couple of folks who had their hands raised. Irene, do you still have your hand raised? Is there something that you wanted to ask or to share? Or whoever is using the account named Irene.
I have a question. The data that you're pulling about from clients as far as incarceration, hospitalization, is it a central database or how does that work?
Yeah, so that's the data warehouse version of the tool. In the data warehouse version of the tool, which I think would not be applicable in a county like Santa Clara because you wouldn't have that. It's if a counties where jail data is integrated into your HMIS data. So if HMIS data is matched to jail data and court data, that's exactly what happens. When a client comes and gives you their first name, last name, social security number, that generates ID that then can allow the tool to go and look for court records and other sorts of jail records.
Thank you for that. I don't want to bog down too much on the technology, but is there any opportunities for blockchain? Because one of the things that I've noticed in the industry is when you're trying to get different agencies connected, they're just in silos. And having a platform where this data can be centralized or, and be connected might be helpful because, obviously if we ask someone a question, either they may not share it or they may not remember, but if they are connected to some, if they've had history of maybe incarceration or hospitalization, having that centralized so that it can, whatever system that's being used can pull from that information.
Absolutely, this is really where we need to go. And folks, I've done work with people who are unsheltered and in street outreach programs, asking them about their comfort of having those sorts of systems, allowing people access to their records in other systems, and they oftentimes people say they prefer that because otherwise they're just answering a lot of questions all the time when they go see, when they're confronted with law enforcement, they have to explain, their whole history, and it gets really tiresome. So absolutely, and a lot of counties, and Pittsburgh is particularly one that's world class in how well they're sharing some of those data systems. So as some people on the call already have pointed out, there is issues of equity in the way in which the Vi Spadettes work.
Rima,
So
before you move on,
this, yeah.
Vaughn has had his hand up for a little while.
Sorry.
That's okay.
Thanks so much. I had a question about how utilization impacts the HOST score. In the data warehouse version, I think it seemed pretty obvious to me, at least, that if someone is a low utilizer, there's a lot less data to do that predictive analysis. And I'm wondering, in your experience with the standard version, if there's any if you've noticed that kind of dynamic playing out in terms of if someone's a low utilizer of services overall, if it underestimates their need?
Yeah, absolutely. There is definitely that potential, and that's why we always allow override of any of these tools so that the frontline worker who is having that conversation has the client in front of them. They can make a basic assessment of whether they feel this tool is underestimating their need because either they're getting out of county services or there's just something clearly inaccurate about the history as far as either the questions are being answered or the way in which the data is fed in. Yeah, totally.
And that kind of override, is that available at the case manager level?
So we allow overrides at case manager levels, but it's just a simple kind of form that says, yes, I want to override. This is what I want to override. It just allows leadership then to go back and look at the overrides, understand whether the tool is actually systematically doing something wrong, or and also allows you to see, like, you know, the racial profile of overrides, all of that stuff, because you want to document overrides, right? So that you understand that. Yeah.
Thank you.
No problem. So when we went back and looked at how Vi Spadettes was working for the same group as the HAST, and what you see is the Vi Spadettes does, this is now being well documented, so I'm sure I'm not telling you something you don't already know. There is a tendency for the Vi Spadettes to underestimate need amongst the Black community, and to a certain extent, the HAST tool has overcome that. We don't know how well it's doing until, you know, we have run it in the field we've run it now for almost a year, so we'll probably be able to say now, but certainly on evidence, it is better at picking up need in the Black community. And we've actually gone and tried to understand why that was. And I mean, this is a really complicated picture, so don't maybe see the picture, but look at but listen to what I also, the story I want to tell is what we did is, because in Allegheny we had such rich data, we could actually go back and look at clients who said they had certain things happen to them to see if in the administrative data they really did have those things happen to them or didn't have those things happen to them. And what we found is that Black clients systematically understated risks, which meant that Black clients systematically had lower scores, even though they had the same number of verifiable ground truth risk. So this is the challenge whenever we use a tool, and including the HAST tool, which just is based on questions. Whenever we base our tools on questions, we have a real challenge in making sure that we frame those questions and we keep them super non-stigmatizing, so we can figure out whether those folks are understating risk. It's a real challenge, because if you start telling people, look, if you understate your risk, we're not going to be able to serve you, well, then they might overstate their risk, which is just as problematic. So this is a real issue for us all in this area, and there's no simple solution for it, but I've just kind of sharing with you, probably you see this all the time, of folks understating their risk, often thinking that those risks, that those questions might actually be held against them in housing. There's also concern, which has been documented in the literature, about homeless Black moms worried that their answers will then be fed to child welfare and their children will be removed, and therefore they understate risk. So there's this kind of huge burden we place upon our community of having to be honest, but still having to think through what their honesty means with their various systems that they're trying to navigate. So in summary, you know, as I said, none of these tools are going to address the challenge that we don't have enough beds. We don't have enough beds, and all we are doing in this tiny little bit of our system is trying to see if the beds we do have are being given ethically and prioritizing people. And frankly, I think that something like a HAST tool, which prioritizes people and allows you to take people right from the top of it, and basically you could use a HAST tool to never have a wait list. Now, Allegheny have not met my challenge, which is I said to Allegheny, I can give you a HAST score such that anyone below that HAST score is told very clearly, you will never get a bed in the current system, so let me see what else we can do. Or I can give you a 2-stage survey, which says the first stage, you're doing a very broad set of questions, and basically at that point saying it's not likely we're ever going to be able to get you into one of our beds. So let's now talk about needs assessment in a more community, wraparound services we can give you. That's a challenge for folks who are so used to wait lists to think of a world without a wait list. But the way the HAS tool works is you set your own thresholds. And if you can set your threshold really high, it means that everyone who meets that threshold should within a month have a bed available for them. You could make it 2 months or 3 months, and it'll be random because beds come available randomly, so we can do the maths, but you can run almost a zero waitlist system if you want to. You certainly not have this whole problem of some of the middle missing out. I mean, that was happening in Allegheny. It happens in every system because of the way in which people are using the Vi Spadettes. It basically means that some people are just missing out, even though they're at higher needs of people who end up in rapid rehousing, or in fact, even in transitional beds. We have people in transitional housing who were prioritized about higher need people because the higher need people were just waiting for 18 months for a PSH bed. The other thing with the HAS is because you write your own threshold, you say, okay, now lawmakers, funders, whoever, here are the people. Here is their risk profile. Here is how likely they are to end up in jail, in mental health inpatient, in chronic homelessness, in in multiple and mortality and so on. Here is the people we should serve, we could serve, but we're not serving. Okay, so just to finalize, I know we're probably running out of time. So, prior to the introduction of the tool, we went back and scored the folks we were serving with the PSH bed, and you could see that basically, according to the HAS score, 33% of those people we were giving PSH beds to would not have scored a high score. After the score came in and they changed their practice, basically no one was a low scoring person. It doesn't mean they didn't. Scoring 5 in a HAS is still a very high need. It's just that, scoring 10 is theoretically higher need. So, so I guess the bottom line is if we wanted to do something like that, this for Santa Clara, we would take your 2015 to 2020 data. We would have to do a one-off linkage with the outcomes that you were interested in, which is mental health or so on. And our research team would train you a model that you would then decide whether you wanted to deploy in what way you'd want to deploy. All right, that's me. Thank you.
I think we can take a couple of questions. I want to loop back to some folks who were waiting earlier and see if they wanted to chime in. Chandra? No, you had some tech challenges a little bit earlier. Did you have any pending questions or thoughts? And okay, what about Jackie Germain? I saw a question coming in the chat from Claudine. Claudine's question is, the Vi Spadettes was also designed as a triage tool where it explicitly states that an assessment should follow the Vi Spadettes. Oh, hi, Chandra.
This is Chandra. I couldn't get myself off mute. I'm sorry. How do we go about finding out our scores?
So that's a good question, Chandra. So at the moment, the way Allegheny uses it is it shares the score with the client.
I can't hear. Anyway.
So Allegheny does share the score with the client.
Anyway, That's on the screen.
I'll write it in the chat, huh?
Maybe while we're waiting, should we go to Marjorie? Or were there others that we missed,
Um,
Sasha?
I think Claudine's question. So the Vi Spadettes was designed where an assessment should follow, and Santa Clara is using the Vi Spadettes as the assessment. So is the main difference between the Vi Spadettes and the HAST the predictive risk modeling? When does the assessment part come in?
Yeah, I mean, that's a good question. So are we using it, but is at the moment, as far as I can see, what everyone's using the Vi Spadettes is to tell us which beds people are being prioritized for, right? It's not telling us what services they should get, what kinds of programs they should be given to them. So HAST replaces that aspect of the Vi Spadettes. Now, if you're using Vi Spadettes also to tell you that this person needs behavioral health wraparound services, then the HAST tool will not do that. But I would be surprised if anyone's using Vi Spadettes to do that, because it's not really even a traditional needs assessment tool.
May I ask a question? This is Consuelo Collard with Catholic Charities of Santa Clara County. And I'm sorry, but I have been a little lost with the posting of the little stick-em notes, and I didn't know how to do that. And I'm trying to do other things while I'm listening. And but I really appreciate everything you said. And Dr. Vaidyanathan, I'm not sure I'm pronouncing your name correctly,
that's
but
amazing.
I have a question.
Yeah, sure.
I have participated in the meetings for the coordinated assessment system from the very beginning. And my recollection is that at one point, Santa Clara County considered doing the type of warehouse data that you are talking about that would help and would facilitate the things that you are discussing right now. And that didn't get anywhere. And I'm wondering what the challenges were that you experience in getting that kind of data warehouse to be able to make predictions about people's circumstances and potential use of emergency systems that are extremely costly, and housing obviously would take care of that. So can you talk a little bit about that? Because my recollection was that the Office of Supportive Housing wanted to do that, but it never got anywhere. So I'm wondering what difficulties you encountered and how those relate to what this county experienced back then that we may still need to address to be able to change a system to something like what you are talking about. Because the real alternative for this to be fair would be to have everybody's Vi Spadettes scores updated before the newer people that are getting the higher scores get referred for a bed in permanent supportive housing. And that's not possible. It means in real time updating everybody that has been waiting for years while the new people with the highest scores are getting the bed. So can you talk a little bit about that, please?
Yeah, thanks, Consuela. I guess when you started in 2015, it was a long, we weren't as advanced in the country as we are now about linking data. Just to be clear, to build HAST, we only need a one-off link to do what's called training the model. Once you've trained the model, you don't need to link data again. A person comes in the door, all you do is you'll do what you're doing now, but with a much shorter set of questions. But what we'll know is that those questions were designed exactly for prediction in your jurisdiction. So that one-off linkage is now the challenge. And I guess I'm more confident now with the counties that I work with that those one-off linkages are easier to do. There's a lot more support for this. You know, we've been talking to HUD about this. I know there's a groundswell of support for trying to get these tools to be really pointing at those high need and high risk events that are happening to folks. So, you know, it's really a question for you guys to see if there's that appetite for that one-off research linkage that we'd need to train the model.
And Janice, I think you had a question. Sorry.
I know Marjorie was before me. She had been waiting for some time if she wants to go.
Okay. Marjorie, are you still here?
Oh, yeah, I'm still here. Well, actually, my question was like, if we were to do something like this HAST model, I mean, how possible is it to create that data warehouse? Because I really think that just through my experience working in homeless services, you know, there are so many intersections between all those different systems at play with the people that we're working with. And so, you know, if we're going to look at a model that's going to be 5 years, 10 years, however long it's going to be in effect, are we even entertaining the conversation about connecting the data so that we can provide the most effective services possible?
Oh, that's wonderful to hear, Marjorie. I mean, we have two HAST. One is for people who don't want to even start the linkage conversation, who just want a model that has this ability to predict, right? That's the HAST. The HAST DW, which is a data warehouse HAST, is the HAST you use if you're willing to go that extra step and start linking all of your different system data. That is totally, I believe, quite apart from coordinated entry, for God's sake, is a system, you know, is something we ought to have. And so I would hope that we have that conversation, whether we do a HAST or whether we don't do the HAST, because it's a madness that we haven't got that. But so I'd kind of like to separate the two, because the timelines and the kind of the efforts for both of those lines of work are something sometimes best to be just sort of in tandem, but not say one is dependent on the other. That's all I'm saying. But hallelujah for that. Yes.
Janice.
And I'm sorry if like this question doesn't make sense. I'm really happy that we're having this meeting. I'm really happy that we're included in this meeting and that we're talking about and that it's being brought to, you know, it's not invisible that the Vi Spadettes hasn't been working as well as it could have, like as it was envisioned or as it was in the beginning when it first came in. But I feel like there are a lot of other things to really consider at the same scale of the Vi Spadettes that are going to become issues, like, you know, when you want to build permanent supportive housing specifically for the unhoused, like, you know, the community disagreeing with that. Like I'm thinking about, I work at CSA in Mountain View, and a hotel that was going to get converted into permanent supportive housing, and how there was an uproar within the community. Or I'm thinking about how Santa Clara County does a really great job at promoting homeless prevention services, but homeless services typically gets left on the back burner. And, you know, being part of the EAN, like I know other EAN struggle so much to be able to provide homeless services because of, you know, there's a lack of resources. So I know, like, I feel like I'm spiraling in my head, but there's like so many things other than just the, you know, just the system that's going to need to be like vamped and enhanced and, you know, slowly agreed upon amongst the community. I think I'm just stating a fear, I guess, but I'm just thinking like there's going to be a lot of work, like, and I don't know like what else. I would love to continue this conversation, like, you know, outside of this and like help with other things, but I feel like there's going to be a lot of things that we need to do just other than just this re-entry thing.
I completely agree, Janice. It's that first box we are not even touching. This has to, versus Vi Spadettes versus whatever, does not address the problems that you're talking about, which are much bigger and are going to make a much bigger difference to address. So forgive me, I'm just not, that is totally on record by me and everyone else who works in this area. We do not have enough. So conditional on us having so little, and the fact that we committed ourselves to triaging and committed ourselves to not, the other option is just to go, everyone who comes in the door is needy, so it's first in, first served is another system we could run, right? So we've said, no, we don't want to run a first in, first served. We want to do some kind of prioritization. It's an ugly word. We don't want to do it, but we have to because of that first box. So now how do we do it in a way that's fair, that doesn't make vulnerable people even more vulnerable while they sit in front of us having to spew out their history, that is fast, doesn't make for false expectations, that is fair, that does address and is also transparent so that we can bring to those folks who can change that first box data about how we're trying to do a good job on the second box. So that's all this piece of work is trying to do, if that makes sense.
And if I could add to, thanks for that comment. I mean, I want to put this also in the context of, this is coming out of the coordinated entry work group. It's not the only thing that the COC is doing to address this. We have a community plan to end homelessness where we're trying to double the number of temporary shelter beds. We're trying to double or triple the number of supportive housing units. All of those other things are also happening parallel to this. So this isn't to say that this is the COC's solution. It's one strategy among dozens that we are working on. And so if like, I love that folks are interested in all the other things as well. So please do reach out to me if there are other ways we can plug you into some of the other efforts going on. So I appreciate those comments. Thank you.
Thank you so much.
Great, folks. I know that we have kept you over time, but we really appreciate the conversations that we're having and your active participation, all your questions. I know that there are a few that didn't get answered. I'm going to comb through the chat and pull those out and make sure we get back to folks with about those questions. And I do also want to preview, we're going to continue having this conversation. This isn't a one and done, and our next meeting will be the second Thursday of next month. Same place, same time. I will send out the information to the usual mailing list, but also directly to everyone who signed up, who registered for today's meetings, so that we can make sure to keep talking to y'all about the redesign. And I want to thank Rima for joining us today and for presenting on system redesign and predictive modeling and answering folks' questions. And thank you all for a great meeting today.
Thanks, everyone. Thanks, Sasha. Bye.